Las Vegas. Welcome to Fertility Thursdays with NFI. I am Dr. Cindy Duke, Medical Director and Physician here at the Nevada Fertility Institute based in sunny Las Vegas, Nevada. First and foremost, I just wanted to say Happy New Year! Guys, it's 2018 and I am so excited for us. We had an amazing year last year, 2017. So many new achievements, and I look forward to all the others that we're going to have this year. We've started some pregnancies. We have babies that we're expecting to be born in the next couple months. So we're super excited here at NFI, and I'm excited for you guys as well. So today we're actually going to be talking about endometriosis, a topic that is very important, but one that is also shrouded in a lot of secrecy. For some patients, it's something that really defines a very painful and sometimes a shameful part of their lives. And I say shameful only because for them, it causes so many downstream effects as a result of endometriosis that they're unable to really feel comfortable about their life and to talk to their friends, talk to family about it. And so my hope for today is that as we talk about endometriosis, is that I can not only impart the knowledge about what this is and what it causes, but more so help to reassure patients that it's not all in your head, that endometriosis is a real diagnosis, one that has real medical management. The management options are varied, and as well what those options are. And on top of all that, to let women with endometriosis know that if it's not addressed early and treated appropriately, it can lead to longer-term outcomes such as infertility, loss of the eggs in the ovary, loss of those eggs, or what we call diminished ovarian reserve. It can lead to scarring of fallopian tubes and thus lead to infertility from tubal blockage. It can lead to chronic pelvic pain such that it causes one to miss a lot of time away from work and, of course, from participating fully in other social activities that one may like to be a part of. And so that's my hope for today. I look forward to your questions, your comments, and your interaction. Do please feel free to share this video, and let's get started. So what is endometriosis? Simply put, endometriosis is the presence of cells which should usually be inside the lining of the uterus, and now they're present outside of the uterus. And so they can be present outside of the cavity, within the walls of the uterus. That's known as adenomyosis. It can be present in your pelvis, meaning it can be anywhere in your abdominal cavity, and that can then lead to scarring and chronic pelvic pain. It can also sometimes, endometriosis has been found as far away as in the lungs of women who have endometriosis, meaning the presence of cells that typically should be in the lining or the cavity of the uterus, they're now present in the lungs, causing some lung problems for patients, and also have been seen in the brain. And so that's what endometriosis is, simply put. It's the presence of cells that are usually part of the uterine lining, now found outside of that uterine lining or cavity. Now, having said that, that would explain how endometriosis works, which is to say, if you think about your uterine lining, in a woman who's reproductive age, who is cycling, i.e. having menstrual cycles, your lining builds up, and then it sheds if you don't get pregnant. And so those cells in the lining, they build up and then they shed in a cyclical fashion. The same thing happens with endometriosis cells, because remember, these are cells that usually can be found in the lining of the uterus. And so as a result, for women with endometriosis, these cells, which are now present in the pelvis, or if God forbid they're in the lungs, etc., they also build up in response to hormones every month or so, and then they shed, i.e. they start bleeding, except they're not in the uterine cavity or lining, so they don't come out like a period does. Instead, you end up bleeding. These cells end up bleeding into your abdominal cavity and your pelvis. If they're in the lungs, they can bleed into the lungs. And that's what leads to the long-term problems that can come about from endometriosis. Because of course, except for the uterine cavity, your body, if it sees bleeding somewhere, your immune system responds to that. And so it tries to stop that. It tries to repair any bleeding that it's seeing, which in turn leads to scar tissue forming. And that formation of scar tissue can then cause scarring around the ovaries, scarring around your fallopian tubes or within the fallopian tubes. It can cause scarring such that intestines or bowel gets stuck to parts of your abdominal wall or gets stuck to the front or back of the uterus. It can get stuck to itself. Bowel gets stuck to itself. You can have endometriosis implant on even, say, your appendix, causing problems. Good night, Joanne. Welcome. So it can cause a lot of issues. And so for a lot of women with chronic pelvic pain that's not explained otherwise, part of the workup for a woman who's having unexplained chronic pain is to identify whether or not she might have endometriosis. And chronic pelvic pain is one of those umbrella terms that can cause a lot of stress for women because it's internal. It's not that external, visible, debilitating situation. And oftentimes women are, and young girls, because teenagers can also suffer from chronic pelvic pain, in the course of seeking help and seeking care for their endometriosis or other chronic pelvic pain, they're labeled sometimes as it's all in your head. You're not really feeling that. Your pain, I don't believe. I think, you only always find some time every month to take time off. For some women, the pain, this chronic pelvic pain, is quite debilitating, quite crippling, and can affect work such that in terms of societal costs in the United States, endometriosis ends up costing the society about $22 billion a year in the United States. That's correct, $22 billion a year. And it's due to time lost from work, wages lost from work, work productivity losses, as a result of women who suffer from this having to take time off from work. It certainly affects families. It affects relationships. Seeing as women with chronic pelvic pain, many times they have pain with intercourse, which is known as dyspareunia. Pain with their periods, by the way, is known as dysmenorrhea. But these can all really, truly affect one's life. More importantly, as I mentioned, it can actually affect your fertility. And that's because endometriosis can affect the ovaries. It can affect it such that you create cysts, which are also known as chocolate cysts. And these cysts, while they cause pain in the ovary, as they get very large, can actually expand and lead to damage of the ovary from sort of a bystander effect for the healthy ovary tissue that's near the endometrioma. But more importantly, most oftentimes as a result of having these endometriomas and other scarring, etc., or needing to identify the cause for the pain that one is feeling, you end up having surgery. Now, to be very specific, surgery is actually the only way to diagnose endometriosis, or what we call the one definitive way is surgery, meaning a doctor, a gynecologist, goes in with surgery, whether it be open surgery or laparoscopic surgery, and they visualize the pelvis, they take photos, etc. But more importantly, they take biopsies of the areas that look to be endometriosis, and they send it off for a doctor who's specially trained, known as a pathologist, to look at it to identify whether or not they see those cells that we just talked about. Does this look like we're seeing cells that should be in the uterine cavity, in the uterine lining? Are we seeing them here in the pelvis or wherever we're looking at? As I mentioned, endometriosis can even be in the lungs. And so women with that particular manifestation, though rare, women with that manifestation often present to the hospital with collapsed lungs, with what's called blebbing in the lungs. And it takes specialized doctors and pulmonologists and cardiothoracic surgeons to go in and find those and treat them, or identify it at least. Okay, as we go along here, other things to know about in terms of infertility and how we manage. So like I said, it can lead to infertility, such that if you have surgery, sometimes to remove those cysts, those chocolate cysts or endometriomas, which are seen in the ovary, the surgery to remove them actually leads to the removal of other healthy ovarian tissue that has eggs. And so as a result, it's not uncommon for women with endometriosis to find themselves having less eggs than is usually expected for their age. And that's a result of, like I said, some bystander effect from just the endometriosis growing and affecting the ovary, but also because they end up needing surgery. For some, they need to have an ovary removed as part of that treatment. Certainly, as a laparoscopic gynecological surgeon, my aim, if I have to end up doing surgery on the ovary of a patient with endometriosis, is to perform cystectomy, which is removal of the ovary, the cyst in the ovary, but leaving the rest of the ovarian tissue there. So really trying to preserve that woman or that teenager's fertility as much as possible. But the bigger key here is we actually try to avoid surgery as best and as often as we can. And so early suppression of endometriosis is really key. It means identifying it early, treating it early, suppression meaning keeping it quieted down so that it's not active. So those include things like treating with birth control pills, treating with medications that are known to suppress ovarian function and keep estrogen levels low, or starting a patient on progesterone medications to help keep that quieted down so that you can prolong their normal healthy state, so to speak. Prevent the need for continued surgery, prevent the need for continuous hospitalization, allow them to have nice functional days at work, in their life, in their social life, in their relationships, and as parents, if they're parents. That's all a key consideration in all we do as we're treating endometriosis. And of course, to help preserve fertility. Now, there's a special group of patients that's near and dear to me, and that is the teenagers diagnosed with endometriosis. Being a teenage girl, of course, comes with all sorts of different dilemmas. And then added to that is if she's having chronic pelvic pain. It can oftentimes be dismissed. Sometimes it takes a specialized physician to finally assess, diagnose, and treat this patient. But there's actually really, really good information out there, and there are lots of data that show that if a teenage girl is diagnosed with endometriosis and put on suppression, meaning putting on medication to quiet or keep endometriosis under control, they're actually able to prolong that pain-free period, delay the need for surgery and surgical intervention, which, like I said, can lead to other scarring and other damaging to the ovaries, etc., that can then cause things like endometriosis, etc., later on, infertility, etc., later on in life. So very important, and I hope that today this information is reaching the right people, reaching those who may be questioning whether or not they could have endometriosis, or simply facing a diagnosis of chronic pelvic pain but feel like it hasn't been fully explored. As a segue, I wish to say that we actually, during the course of 2018, will be exploring a few other facets of chronic pelvic pain. So not just endometriosis, but other facets, because like I said, chronic pelvic pain actually affects a lot of women. It actually is underdiagnosed and oftentimes under-evaluated, thus leading to many women being left to think that it's all in their head, when in fact it's not the case. So we've talked about teenagers with chronic pelvic pain. I talked briefly about how endometriosis is diagnosed. And like I said, the gold standard definitive way to diagnose endometriosis at this point is surgical. It's via usually laparoscopy, which is a process by which a patient is put to sleep, and doctors make a tiny incision, usually through the belly button, and they go in with a camera, look around, take pictures, assess. Oftentimes they treat as well. They can remove scarring. Sometimes if the scarring is so extensive, the doctor who does the first surgery may choose not to operate and instead refer the patient to a more specialized gynecological surgeon. So that's how it's diagnosed. The next question that a lot of patients ask me is, does every person who has endometriosis have to end up with hysterectomy? And the answer is no. So while surgical diagnosis is required to truly make the definition, textbook definition of endometriosis, and while certainly hysterectomy is sometimes recommended for patients as the gold standard treatment, meaning the definitive treatment for endometriosis is considered removal of both ovaries, removal of the uterus, i.e. hysterectomy and oophorectomy, that, as you can imagine, is pretty complete. It's pretty thorough, and of course ends your fertility if it were the case that you hadn't had children yet or wanted to have more children. And so in my work as a fertility specialist, a reproductive endocrine doctor, I actually do see quite a few patients who are sent to me for a second opinion for managing their chronic pelvic pain or their diagnosis of endometriosis prior to maybe the next step, which is often a decision of whether or not to do hysterectomy or not. And like I've said, for a lot of patients, there are many options in between that one can explore before hysterectomy is placed on the table. And certainly I do not recommend just jumping to hysterectomy simply because you've been diagnosed with endometriosis. There really are many options that can allow a patient to live pain-free, comfortable, still preserve their fertility, and not feel like it's debilitating their entire life. Let's keep going, and we'll also go through some questions and as we go. So who should you see if you think you have endometriosis? If you haven't already, I would recommend you schedule an appointment to see a gynecologist. Again, that's an OBGYN, but specifically someone who is actively practicing gynecology. Go see them, go have a conversation. If you cannot simply schedule an appointment, maybe request a referral from your primary care doctor so that you can be evaluated for endometriosis. You're certainly welcome to come see us here at Nevada Fertility Institute as well. But for most insurances, you will be required to see your primary gynecologist at first. In terms of other things that cause, so if you're sitting there thinking, can endometriosis be the cause for all my painful periods? It could be. Now, there are other things that can cause painful periods, but I have to be honest with you, endometriosis is a big culprit. It's a big, big reason why many women have painful periods. Can it cause pain with intercourse? As I mentioned earlier, it absolutely can. And if it does, it may require what we call a multidisciplinary approach. And it's certainly what I employ. So not only would you see a gynecologist or a specialized gynecologist like myself who can treat with medications to help quiet down the endometriosis and stop its activity on a monthly basis, I usually also have you see a pelvic physical therapist. These are physical therapists who are specifically trained to treat patients with chronic pelvic pain, who can help you learn different feedback mechanisms. They also have lots of different options, including electrostimulation, etc., that can desensitize the areas and help you function better, help you live better, and also help you have a more functional social life and sex life if endometriosis is causing you problems such as those. Okay, we have a few more questions coming in. So one question says, what happens if you do nothing to treat endometriosis? Well, what I would tell you is if you're someone who has endometriosis and does absolutely nothing about it, it would only continue to progress. Now, that said, there's a flip side to all this, which is there are some women who are living who don't even know they have endometriosis, meaning they have endometriosis, it's growing, and maybe she either has a high tolerance for pain or she just so happens to not have pain. There's still a lot of research going into endometriosis, and endometriosis manifests differently in different women. So I hope that I'm actually able to communicate and convey that today. So one woman may have endometriosis that's only affecting her ovaries. It may or may not cause her pain. It may or may not cause her any problem. She may not even be aware that she has endometriosis until she maybe goes to see a fertility specialist. And in the course of her workup, they discover that she has these, like I call it, chocolate cysts, which are cysts filled with old dark blood from the endometrioma, the endometriosis constantly bleeding into that cyst. Some other women have not much visible endometriosis when you look into their pelvis with a camera, but they're in excruciating chronic pain. And of course, like I said, there are other places in your body that endometriosis can affect. One question here says, how would you approach getting pregnant with endometriosis? Is it safe? Yes, with a caveat. So if you're attempting pregnancy, endometriosis may or may not affect your chances for pregnancy. It depends on how extensive your endometriosis is and what it's affecting. Is it affecting the ovaries, i.e., like I said, is your egg reserve less now because of that? Are your tubes scarred? Maybe you may need to have in vitro fertilization because endometriosis has scarred up your fallopian tubes, and thus you cannot get pregnant via more conservative or natural ways. One other question is, what is the likelihood of endometriosis after C-section? Well, C-section by itself hasn't been shown to cause endometriosis. But what I would tell you is women who have endometriosis, depending on what sort of scarring it's caused, some of them may end up needing C-section, cesarean section. Others may have a longer time to delivery of their baby, meaning if the endometriosis has caused a lot of scarring in your pelvis, and let's say your bladder is now stuck to your uterus, or maybe the uterus and the bladder are stuck to the front part of your abdominal wall, it may actually complicate your cesarean section and require a longer time for your obstetrician to carefully dissect away that scarring so that they can safely get to the uterus and your baby. Let's see here. We have another question, and it says from Joanne, thank you for educating me on this topic. Now I can have a discussion with my family who have severe periods and pain. Good, I'm glad. My whole goal today is for not only to talk about how endometriosis can cause infertility, but really I just want to help with that public announcement and that public relations, letting people know endometriosis is real. If someone's having chronic pelvic pain and debilitating issues, etc., it could be endometriosis and it shouldn't be dismissed. Another message says, 3 months ago, I began having pain with sex, deep burning sensations lasting hours and hours after sex, making sex not something I want to do. My friends told me it could be endometriosis. Could it be something else? Now, that is the short answer of, could it be endometriosis? Yes, it could be. Could it be something else? Yes, it could be something else. My point being, those symptoms actually sound pretty serious. I would recommend you go see your gynecologist for an evaluation. Part of the evaluation would include figuring out whether or not you have endometriosis, but it would also include looking for any other signs and symptoms of other things that might be causing pain. Sometimes there's something known as interstitial cystitis, or IC. We will actually talk about that, as I said, in our ongoing discussion of chronic pelvic pain. The discussion of interstitial cystitis is intended for March of this year. So certainly tune in. I know for this particular person who's inquiring, waiting 3 months to hear more about IC won't solve your problems right now. So again, I recommend going in to see your doctor to talk about it, okay? And if you don't have a gynecologist, I would recommend seeking one out, okay? So again, it was a pleasure to talk today. Today we've talked about endometriosis. What is it? Is it real? Yes, it is. How is it diagnosed? How is it treated? And also talking about what other things it can cause or lead to, such as infertility, chronic pelvic pain, absences from school if you're a student, absences from work that can then lead to loss of income for you, the employee, etc. Questions here. Do you try medications before surgery? Absolutely. So I would tell you most gynecologists will try medications before surgery. Some are more aggressive than others. As a subspecialty OBGYN, who is also a subspecialty trained physician for managing endometriosis, I have in my toolbox a lot of options for treating endometriosis that extend beyond using the routine birth control pill. And so I have patients for whom I've used birth control pills, but I have others for whom I've used more nuanced medications, which include things like using a class of drugs known as GnRH agonists, another class of drugs that are known as estrogen inhibitors, things that prevent the production of estrogen, because estrogen, which is made by your ovaries, is the active hormone that drives endometriosis. So much so that if a woman goes into menopause and she suffered from endometriosis in her reproductive years, her menopause symptoms, the act of going into menopause actually is what I meant to say, can lead to improvement in her symptoms. So the painful periods go away, obviously, because menopause has happened. Some of the things from the scarring, etc., may continue, but usually you see some improvement in symptoms for the majority of women with endometriosis when they go into menopause. Okay, well, thank you so much, guys, for tuning in today. I really enjoyed this. I hope you did too. Do feel free to continue sending us your questions, your comments. We have a lot of really interesting topics coming up this year. In addition, I actually have guests this year, guys. So tune in, stay tuned for our postings about our events. We, as part of some of our Facebook Lives, will have a few promotions and giveaways. So do feel free to share and tune in. Thank you so much. We look forward to seeing you in the future. Happy New Year, and let's make the best of 2018, guys. Good night.